include just a preoccupation of how you're going to get or keep fulfilling your need or desire for the substance, which is one of the complications of a substance abuse disorder. If you feel like you need it on a regular basis, that can be hard to maintain. It can be expensive. It can be, one of the things that you mentioned, I think that's really important as far as that goes. The American Disabilities Act has done a lot for access to different services, but as far as substance abuse treatment and access to substance abuse treatment or places that people with disabilities can go that have services, not very positive at all. First of all, there are complications, and one of the things that I've had the benefit of, I actually, working in a hospital, I worked in a hospital that had both a psych unit and a medical rehab unit, which is where you'd get a lot of people with disabilities or that happened as a result of a car accident, things like that, and diagnosing a substance abuse issue along with a disability in some ways was easier with that particular population because the rule of thumb there was if they had a substance abuse problem before the accident, they probably will continue to have that substance abuse problem after the accident. But the only way we could really provide treatment services is people would actually, it was a residential program, and they would have their bed or be in the other program and just come down to certain services, because you also got a big part of substance abuse treatment a lot of times is group therapy. A lot of people with different mental health issues don't do well in therapy. So one of the most effective methods that is used just doesn't really work. You also have the problem, and I think back on so many different clients, and especially clients with schizophrenia and things like that, or different disabilities that require medication. Well, with substance abuse treatment, the goal generally is sobriety. And then you got mental health disorders sometimes where the goal is convincing a person that they may have to take medication the rest of their life. And then they have substance abuse treatment where they're hearing people say abstinence, and it kind of complicates things quite a bit. And one of the things that happens, even, I don't know how many people of you are sitting here that are going into social work, that kind of thing. One of the things I would just like to strongly encourage, because unfortunately, even though there's been attempts to try to change some of this, you have mental health services and you have substance abuse services. A lot of times they are separate, and you'll hear social workers or different people, different mental health people all the time say they don't really have a background in substance abuse. It's sort of seen as a specialty, and I just think that it's extremely important from identifying the co-occurring disorder issue that social workers, caseworkers, vocational rehabilitation workers have some knowledge of substance abuse. Because one of the things is when you're talking about a co-occurring disorder as well, it can be very difficult to identify if it's bipolar depression issue. What really is the symptoms of bipolar, and what are some of the symptoms that are very similar to a substance abuse issue, a substance dependence issue. And I was actually in a training not very long ago, and it was done by, and it was a mental health first aid training. And two of the people that were presenting, in fact, said is still, as far as they're concerned, you got a co-occurring diagnosis issue, specifically a substance abuse issue and a mental health issue. What really do you address first? Now, ideally, addressing them together would be the best thing, but in some ways, I've always been brought up that the rule of thumb is you have to address, depending on the level of the substance abuse issue first, to see what's left, kind of. We have to do away, you know, if the depression, if the depression is related to the problems or the consequences of the substance abuse, then you have to take that out of the picture first.